Hi, Super Mamas. Hi, Girl Gang. It's Dr. Joy here, and you are watching Delivering Joy MD Welcome. Today, we have a combined episode because we are talking to moms and families everywhere. I am so interested in this formula shortage crisis, and I brought some experts, some subject matter experts, to talk about that this evening. Make sure you keep watching. All right, we're back. And boy, do I have some experts in this area for you. Let me tell you who I've got for you today. Teresa McCullen is an IBCLC. She is a pioneer and one of the first Black international board of certified lactation consultants, or IBCLC. You'll hear a lot of that term used tonight. And so she is in private practice in Georgia. She helps women learn how to breastfeed, successfully breastfeed, and she helps develop infant nutrition plans. So she's going to be talking to us tonight. She joined the Augusta University Hospital system, where for almost 3 decades, she's worked closely with and been a resource to the medical and nursing education directors. She works extensively with families in acute care and clinical settings. She's speaking with us today in her individual capacity and not as an employee of the hospital, just like me. I don't ever talk to you as an employee of the hospital, but just as myself. Tonight, we also are joined by Marsha Walker, who is an RN and also an IBCLC. She is nationally known as an expert in this field and lives all the way in Massachusetts. So we're so excited that she's joining us tonight. She is one of the nation's first IBCLCs and has a wealth of clinical experience. So we're going to benefit from that tonight. She is the author of textbooks and has taught so many people about lactation. She's highly published, and she's the editor of the Journal of Clinical Lactation. Marsha and Teresa serve on the board of the National Lactation Consultant Alliance. So we're so excited to have them with us tonight. And last, but certainly not least, is someone who I think is just phenomenal, such an advocate for women and children, Merrilee, who's a BSN, RN, and a JD. So not only is she a registered nurse with her Bachelor's of Science in Nursing, but she's also an attorney. She has been advocating for maternal child health for decades and has served on numerous state and national nonprofit boards. Merrilee has a passion for volunteering and advocating for legislation and policies that support mothers and babies. Thank you, ladies, so much for joining me tonight. I'm super excited to have you because I think this is such an important topic, not only for my patients and your patients, but also for the community. And I'm so glad that you all are here to talk about this. One thing that was quite puzzling to me as I was reading about this and watching this story unfold was that there seemed to be all these different ideas about how this formula crisis evolved. What are your views on that? I think I'll start with you, Marsha.
I think part of the problem is there's in the United States, there's a lack of diversity and a lack of businesses that actually manufacture formula. In other words, what we have is a couple of companies that produce 90% of the formula in the country. It's a highly concentrated business where you've got a couple of large factories making a lot of the formula. The factory that shut down made 51% of those specialty formulas. It's putting most of your eggs in one basket. So when something goes wrong, you've got a huge deficit now in the formula that's needed. We've got policies in this country that put a very high tariff on imported formulas. There's over a 17% tariff on imported formulas, so they're not brought into the country. The Food and Drug Administration won't let many of these formulas into the country. So now we can't import them, and we don't have a diversification of where we can find formula. We've got policies that prevent many of our families from choosing the formula that they would like to use. And when you only have a couple of companies making the formula, they lack the knowledge to be able to choose a formula that perhaps they don't want their baby to have. And so what we've got is a series of regulatory barriers about how formula is actually made and distributed in this country. We have a lack of diversity of who's making the formula. And then there are high tariffs on even importing the formula. Then you couple that with a shutdown of one of these plants, and we have a shortage.
Wow. You know, that was something that I had read about, was that there are definitely very few companies who manufacture formula in large quantities. And then in terms of the patients who may be restricted in which formulas they're able to access, there's certainly some policy issues at play here. How have folks been able to access formula in the past? Are most of the patients that you serve using the WIC program, or are they purchasing as private pay patients, or what has been your experience in the past?
All of the above, actually. Now, in the past, if you were in the Women, Infants, and Children's program, and currently right now, you didn't have a choice in terms of what formula you were going to feed your baby. You fed your baby the formula that the state had bid on. So you've got a bidding process now where the state then purchases the cheapest formula. Not necessarily the best formula for your baby, but it comes down to the bottom line. And so that restricts people from being able to choose the formula that they want to use. And so in the WIC program, if one of those formulas is no longer available, which is what's happening now in many states, now they have to figure out, well, how am I going to use that coupon to buy formula when it's not available? And so that's why there is the administration now has asking states to relax those prohibitions and allow parents within the WIC program to purchase other types and brands of formula so they can feed their baby. With people who are not within that WIC program, you go to the grocery store, there's nothing on the shelves. Where are you going to find this formula? Now, these are standard formulas. There are other formula makers within the country that are smaller. And now some of these are lesser known brands, but many of them have formula that's available. And one of the things that just happened to a family that I was consulted about was, this was a breastfeeding family. You know, they just had some questions about breastfeeding, not an issue. And what happened the day that we were talking, there was a case of formula that showed up on their doorstep. And these were samples from the formula company that had been sent out. Parents didn't ask for it. They were just free samples that showed up on the doorstep. Now, why is that happening when those samples should be on the shelves so people had access to it? And you can see that there are so many things that are impacting this. It's a moving target in terms of what's causing the problem.
Absolutely. I think that this is such a very interesting thing. I saw so many dynamics at play here and so much spin in the media. Teresa, what has been your experience here in Georgia? I know Marsha's in Massachusetts, and so it's very interesting to hear her take. What about you? What have you been seeing, and what is your sense of what's happening here with this formula shortage?
It's very similar to what Marsha described for her in Massachusetts. One thing that's a little different is that's not different, but in addition, families are having to expand the way that they find formula. have had several families who are going to the internet and ordering formula because some of the marketers of formula that are not in the US, for instance, in Europe, you can order formula online, and families that have the resources or are using that as their source are ordering formula from other countries. Now, that's not something that's available to families who are using WIC as their main source of formula.
I've been hearing a lot about that too. Have any of your patients talked to you about price gouging online, where suddenly the prices have skyrocketed?
Absolutely. It goes with the territory when you're talking about a product which formula is at the end of the day. And so families have experienced that. The folks that are using the internet and ordering formula, generally just the way we absorb the gas prices are just absorbing them. But that leaves a huge group of mothers who are not able to order from the internet. And so what I find that they're doing is doing a similar thing by accessing resources of people that they know, getting formula that people have, they didn't use it and their baby's not drinking formula anymore, so they're using those kinds of resources. Eventually that will dry up, and so hopefully what the government is proposing to do will fill in before families find themselves in a situation where they don't have access to what they need to feed their infants.
I was listening to a story on NPR that was very interesting. I heard that some patients were even taking their babies to the emergency department, just looking for formula, looking for ways to feed their baby.
In my experience with moms in the hospital where they have a newborn baby and they're anticipating an issue where they won't have enough formula for their infants, they're asking the staff to provide them with a supply, for a week or a month so that they're able to have enough to feed their baby. And of course, that's not usually something that hospitals are willing to do. I have not heard of moms coming to the emergency room in my experience to get formula, but because that's like a Band-Aid. If you come in to the hospital, they will give you enough for your baby while you're there, perhaps, if that's part of the policy, but it doesn't solve the long-term situation for a lot of moms. And I'm going to say here where I am in Georgia, mothers are worried and they're concerned, but people haven't gotten to the panic stage yet in my field of influence. But we certainly hear about it, and we know that it's part of the story.
One of the things we've seen here in Massachusetts is many calls to our milk bank. We've had many calls coming into the New England Mothers Milk Bank looking for pasteurized donor human milk. And so many of our milk banks now are desperate for mothers to donate their extra breast milk so that there would be some excess milk to be able to give to desperate parents. And this is especially true for parents who cannot find those specialty formulas, which are really tough to find right now. The other thing that we've seen is the online access to a site called freeformulaexchange.com. And this is a national website that matches people who need formula with people who are willing to donate what formula that they've had. So it's a matching system where they can match up with around the country is who needs what and where.
What an amazing resource. We're definitely going to make sure that's put in our description box below. Merrilee, I am interested. I know that you have been on the front lines of advocacy for this work in Georgia for quite some time. What are you seeing just in the local community at the grassroots level? I know that you've been out just looking around, walking the stores, just to see what's available in your own community. What have you been seeing?
Yeah, so for the last 3 weeks, I've been going to various stores to see what they've got. And it seems that most every store has a little bit of something. They tend to have a good bit of the toddler formula for babies who are over a year old. but not much for infants. I was back at my local Target today. There were the ready-to-feed little bitty formula bottles, the Similac brand. So they have enough probably for one baby for 1 week on hands. But it was different and new from what they had last week. So they are trickling in a little bit. The other stores I've been to, some of the grocery stores, really barely anything. But there is some formula out there. If you don't have a special need, they are able to get something off the shelves, but not a lot.
This particularly concerns me for my patients in the West Georgia area because a good number of my patients are enrolled in the WIC program. And a good number of my patients, probably about 60%, are formula feeders. Those moms who might be co-feeding, meaning they're using both formula and breast milk. Are there any practical tips that we could use for those moms who are using both breast and formula?
Well, I would suggest, and perhaps Marsha and Teresa can give more detail, but I would strongly suggest right now for breastfeeding mothers who are co-feeding to try to increase their milk supply and use more breast milk and less formula, at least until the shelves are ample full again. And any mother who's about to deliver or has just delivered in the last few weeks, they still have potential to build up their supply. And then until we get through this crisis, every mother who we can help to breastfeed, we really need to be doing that. Even if it wasn't something that they had planned to do, as long as we can, and some mothers just absolutely can't breastfeed, and we certainly understand that and want to support them in getting formula to them. But if they are a mother who can produce milk, we need to be, as a state, we need to be circling those women and providing them all the clinical help that we can give them if they have issues to get them through this hump. And also, if they're a working mother, Georgia in the last few years, we were one of the first states in the nation to pass legislation so that if they're a working mother, they can have access to pumping at work, and it is paid time. It's not a break time that they have to be discounted for their work hours. Even if they're salaried or an employee by the hour, they are guaranteed break time to go pump for that baby. There are only a few exceptions to that. If it's a private employer with fewer than 50 employees and the employer can prove that it would cause an undue hardship, then they might not have to provide that service for those employees, but everyone else must provide a woman private space and time to go pump.
Very, very good point, Merrilee. Like, we have to make sure that women have the space that they need and the time that they need to be able to continue breastfeeding after return to work. And that's a huge thing on employers. And it should be a safe, private space, not in a restroom, because who prepares their meals in the bathroom? Right. No one. That's gross, right? So we want to make sure that women have that space and that employers are living up to that. Studies have shown that mothers of newborn infants and young children are actually very productive if they're given the support to do their jobs and to mother their children in the same space. So they're actually sometimes even more productive than employees who do not have small children, because they have learned to budget that time. So them taking that 15 to 20 minutes to go and pump, they're going to be more productive because they know I have to still get my to-do list done and still have several breaks throughout the day to go and pump. You know, funny story, one of my colleagues when I was a resident had a newborn right before we started residency, and she breastfed her baby for at least a year. And we had, we were new and we were trying to get as many deliveries as we could, and we were so excited about being on the floor. And I remember her just sitting down to pump maybe about 5 minutes before, and then they called overhead and they said, resident to room so and so for delivery. And I started heading that direction because I thought, well, she just sat down to pump and I want her to have that protected time. Boy, she shot past me down that hallway. Breast pump still on, and she had just thrown a gown over her shirt. So, if we provide the space and the time, I think you see that moms do phenomenal things at work, even though they may be breastfeeding or pumping. It's important to talk about some of the other tools, clinical tools that we can implement to help increase milk. And one thing I think is so important, we are all in this together as women, as mothers, as families. And for those who can produce milk, it's great to do that. And if you are producing lots of milk, maybe consider donating. Would you guys agree, Marsha and Teresa?
Absolutely. I often, several times a week, have calls from mothers who are producing extra milk and they would like to know what they can do about it. Unfortunately, we don't have a milk bank here in Georgia, but most milk banks are able to accept milk from mothers, any location rather. So they will help you ship your milk to the milk bank. In terms of, and mothers often think that they're able to bring their milk to, for instance, the hospital, and then mothers who need it can just come and collect it. But that's not how the milk banking system works, actually. And so I don't know about Marsha, but often I have talked with mothers and had conversations about them getting milk from mothers that they're not related to. And that might be a controversial topic, but it's something that I think that we should at least talk about, so mothers who are considering that, we can give them the information that they need if they plan to do that. I generally encourage a mom, especially moms who are co-feeding, to work with their physician and work with a lactation clinician to do the things that they can do to increase their milk supply. You mentioned medication, I think at one point, Dr. Baker, and there are some medications that are used that mothers can get from their care provider to increase their milk. There are also practical things that you can do. One of them is, and sometimes this gets missed, remove more milk so that your body knows to make more milk. And so having the support of a lactation clinician can help you put those things together so that the end result is you're able to make more milk for your own baby.
That's exactly right, Teresa. One of the best things that mothers can do is to contact somebody like Teresa or myself, and go and make a plan. What is the situation? How can I increase my milk production? Do I need to express extra milk with a pump or hand express? Do I need to feed the baby more frequently? Are there medications I can take? Many of the moms that I've worked with want to take supplements like fenugreek or all these herbal supplements, but we have to be careful with that. Many of those are not well studied. Many of them don't work. And what that does is it just delays the time to get effective help. So we want to be very careful about what we would be taking ingesting in order to make more milk, so that there are options there. But one of the best things to do is to call someone like Teresa and say, okay, this is what I want to do. Teresa's going to sit there and make a plan. We're going to pump X number of times per day. We're going to make sure that you are eating a balanced diet. We're going to make sure that you are aware of situations like milk sharing, which is what you were talking about. We have to be very careful about that. Milk banks screen their donors very carefully. They do blood work on them. Now, the Academy of Breastfeeding Medicine has a very good statement and publication on safe milk sharing. And so we would want to make sure that the clinician that's working with the mother is aware of those guidelines. We have to be careful that mothers are not purchasing breast milk over the internet from unknown people. That can be very dangerous. And so what we want to do is put some cautions out there too. We know the situation's desperate, but we have to also be very cautious that we do not use something that is potentially harmful.
One of the big reasons we got into this mess was that there was contaminated milk out there. So you don't want to jump from the frying pan into the fire.
Exactly. We have to be very careful about that. But most of these things are doable. Most mothers, not all mothers, but most mothers can at least see some increase in their breast milk production, depending on their situation, of course. So that's a good option for anyone who is co-feeding, who's doing both. And I think Merrilee also mentioned that if you're pregnant, consider breastfeeding, at least temporarily, until we get past this crisis. And there are a lot of people out there to help. There are baby cafes. There are WIC breastfeeding peer counselors. There are doulas. We've got IBCLCs. So and we've got Dr. Baker, who knows what she's doing. So we've got a lot of people out there who can help. And the thing is that we need moms to reach out for that help.
In Georgia, we do have a Georgia Breastfeeding Coalition with a website that has a lot of information for moms. But we also have something called Zip Milk. So if people want to Google Zip Milk Georgia, they will come up with a list of not only IBCLCs in the state, but also the lactation educators and counselors, physicians who specialize in breastfeeding medicine. So there's a list of which people can then look to see if there's someone in their area who can help them. So we do have those resources. In Georgia, because our lactation consultants are licensed, we have 3 insurance companies that have them as in-network providers. So right now we have Kaiser, Aetna, and Humana. So if you're insured with one of those 3, those insurance companies do have some in-network providers who are also IBCLCs. On the Medicaid side, our Georgia General Assembly did pass a law 2 years ago to give our mothers and babies who are Medicaid recipients access to lactation care when they need clinical help from an IBCLC. But the state has not yet implemented that provision of care. So we are I check with them every couple of months. Where are we on this? And they just have not yet done it. But that will be a service that will be available to our Medicaid recipients, hopefully very soon.
You and other advocates have done tremendous work, and that Representative Sharon Cooper has really pushed this. Why do you think we don't have that in place yet? Because it's such a we all know breastfeeding is such an important part of health. We know I can't even count all the studies. PubMed Search will give hundreds of thousands of studies that show that breastfeeding is the best way to feed infants. So why don't we support that? Because I see it every day. Moms may start out deciding that they want to breastfeed. They start the process. They may breastfeed for a day or two, and then they go home usually at 24 to 48 hours, right at the time where breastfeeding is going to get the hardest.
Right.
So, and then there is no way for them to get the necessary support after that. And for us, we're fortunate in that we are able to order breast lactation consults where they can come back up to the hospital and meet in an ambulatory setting. But for many hospitals, they don't have that opportunity. Why do you think we're kind of running behind on implementing this?
Well, I can tell you that a lot of people believe that breastfeeding is just natural, that all a mom and baby have to do is just do it. And they don't really appreciate the fact that there are so many moms. The data shows that only 4 out of 10 of our breastfeeding mothers are able to meet their own personal breastfeeding goals. And the drop off is huge in that first 6 weeks. So it's getting started, it's getting the right help at the right time. And if we just were able to provide them that clinical care, I know we could increase those numbers significantly. But unfortunately, as I said, a lot of people, if they're not clinicians working in the OB arena, the lay public just thinks that all you have to do is put the baby to the breast and that's it. And unfortunately, that is not it.
It is a learning curve, a steep learning curve indeed. And it can be very difficult for some moms. There are just so many factors that are at play with successful breastfeeding. I was reading on the internet, which, so of course, this is a valid source, but I was reading about relaxation. And I wanted to get the expert opinion because I have had some moms ask me about this. And should moms who had previously breastfed try to relactate?
I've had a lot of experience helping mothers relactate. It kind of depends on how far they are from delivery. Obviously, if they're within a few weeks or even a month or two, we often have very good success in bringing in at least a partial supply. Now that success rate, of course, goes down the further you are from when you deliver the baby. But it is certainly something that is worth trying, but it takes time. It is doable. We, at least around here, we tend not to use so many medications, but we tend to try to use the physiology of the process. What do we know about the physiology? What can we do to kind of give it a boost?
For moms who are formula feeding specifically, how are you advising, if at all, those moms? Because I've been very careful about the advice that I'm giving and making sure that they're reconstituting properly. Because I can see the potential here for people to start rationing formula and watering it down or just not providing appropriate nutrition. What sort of advice do you have for those mothers who are formula only feeding?
Now, the powdered formula, of course, is less expensive, but they could use a ready to feed formula, which does not require anything other than pouring it into the bottle. There is concentrated formula, which you reconstitute with water. And then, of course, there's the powdered formula. It is highly dangerous to dilute the formula. We've had situations around here where parents have added something to the powder, and you don't want to do that either. Okay, nutrition for infants is very specific. So we don't want to fool around with the powder itself.
So your soy whey protein powder does not belong in the infant's powder. And that's exactly what I was hoping you'd say.
Absolutely not. Please do not put anything like that in the formula.
Yeah, you don't need to add stuff that our muscle milk powder or any other things to the infant formula to thicken it or make it stretch. We should not be doing that. That is a big, big no-no.
Don't do that.
Yeah, absolutely don't do that. Teresa, would you talk a little bit about warning signs? Like, how do we know that baby is not getting enough, be it formula or breast milk? What are some warning signs that moms can look out for if they're concerned that baby's not getting enough?
In line with what Marsha was saying, what everyone has been talking about in terms of safety, when families leave the hospital, usually the pediatricians give them strict guidelines about how much milk baby should be getting and what you should be seeing. I'm speaking about young babies, so babies in the first couple of weeks of life. Your baby was feeding fine, waking and sleeping fine, and that changes. That can be a warning sign. With new babies, as you guys have alluded to, things happen very rapidly. So you want to be aware of what you should be looking for. If your baby is not having the same number of wet diapers or dirty diapers that you have been told you should expect, that can be a warning sign. Any changes, really. Generally, if you refer to the instructions that you got when you left the hospital, look at those carefully. If you see anything that makes you concerned, you want to check with the baby's doctor.
One thing I try to help my moms remember, because there's so much information that we give out at discharge, it's like a whole textbook. I think it's so much, and we should really see that baby be starting to wake up and be more vigorous and be ready to eat. And I always am concerned when I see a mom who's breastfeeding and say, "Oh, I have the best breastfeeding baby ever. He sleeps all the time. He wakes up for 5 minutes and then he's back asleep." And I'm like, "Oh no, I hardly ever have to change his diaper." bad news. Like, we should be really vigorous. We should be waking up. We should be making feeding cues. We should be getting a little hangry sometimes. We should be ready for a diaper change. So I get really concerned when I hear that sort of thing. What other things might we look for, Marsha?
Obviously, the lethargy. If the baby is not waking up, if the baby is feeling kind of limp, looking very pale, these types of things that would indicate that somehow or another the baby is not doing well. Scant urine, where we're not, like Teresa was saying, where we're not getting the diaper count that we should be seeing. High-pitched crying or no crying, those types of things, and basically it's a big change from the baby's behavior before. And what I tell parents is, if you have a gut feeling, you look at that baby and you say, I'm not so sure, make the call. Don't wait, just do it. I'm happy to get those calls. Teresa's happy to get those calls. You're happy to get the calls. We're all happy to get the calls or to see the baby, because we don't want bad things to happen. And like Teresa was saying, things can go downhill fast. These very young infants can have problems very quickly. That's why we do not want to be diluting the formula, because that can damage the kidneys. We don't want to be doing damage. So make the call. There are some programs now that use texting, two-way texting. So using the texting type of messaging keeps very close monitoring on our parents, because we can text, say, hey, how many diapers are you getting today? How's the baby looking? Text me a picture of the baby. This type of thing, where we can monitor this much more closely, especially out in these lactation deserts where there isn't a whole lot of help.
I think that's an excellent idea. As we get ready to wrap up, Merrilee, can you talk to us a little bit about how parents can advocate for themselves? I think that the expansion of coverage for patients who are on Medicaid, which about 65% of births in Georgia are on Medicaid. And so if they want to have access to folks like Teresa and Marsha and be able to have those lactation consulting services and doula services and just labor and birth and newborn care support services, how can they advocate for themselves and for their family to be able to access this valuable information and support?
Well, this is a very good time of year. Voting is tomorrow. So when people go to the ballot box, they need to be looking at who's running for the offices for state Senate and state House. And they can follow up with whoever wins. They can follow up with phone calls. People need to speak up. And if they get enough phone calls coming in from constituents that this has not yet happened, where is this service? The General Assembly voted 2 years ago for our moms to have this service. Also, if they have any connections with anybody at DCH, that is the state agency that runs Medicaid for the state of Georgia, the Department of Community Health. So there are phone numbers for the Department of Community Health on their website. Have the mothers start calling that agency. Ask for it. Until there's enough groundswell of people demanding this, the General Assembly wants it. They passed it. And the DCH has been given the directive to do it, and they haven't done it. And I'm mad about it. I am mad about it. It needs to be done.
Well, I think it definitely needs to be done too. I think we know that a lot of our issues stem from not getting the healthiest starts. We see tons of obesity, hypertension, diabetes, and not only just for the babies, but for the moms. And not saying that breastfeeding is going to be the cure-all for all of the things that we see, but particularly in a state where we have such high obesity rates, such high rates of diabetes and heart disease, we need to be giving our babies the healthiest possible start. And part of that is supporting moms who desire to breastfeed and helping them meet their breastfeeding goals. So I totally agree with that. Thank you all so much. I am just absolutely grateful to each of you for taking the time to have this discussion. And we are certainly going to keep you all in our Rolodex so that we can have future and further discussions about the importance of breastfeeding and practical tips that moms need to know. All right, super mamas, we'll catch you next time. Peace.